The COVID pandemic really underpinned the importance of global standards in healthcare.
The supply of a lot of products as a result of COVID-19 across the world became very critical and in short or limited supplies.
It's personally painful when we would see inventory trapped someplace where you need it somewhere else. And they may have picked a location that's not where we wanted it to go, and that you can't get it or you can't find it because we don't have that visibility.
In order for us to be able to find where our supplies were, to predict how long our supplies would last, we had to understand the source.
We have learned that we are all dependent on efficient and safe supplies and supply chain, and standards make it just so much easier and much safer for us to provide health care.
It's that fact alone that has made us realize that we have to do it with global standards being applied.
As we look at the future with the vaccines that are coming in, the challenge or the issue we will have in the very near term is going to be identifying perhaps what products were given to which patients and when, if they don't happen to have that barcode that can be scanned and captured.
And that's what GS1 is all about, is how we're accelerating this impact really on outcomes, on the healthcare outcomes for people around the planet.